Welcome. I'm Dr. Emily Helder, an adoption researcher and scholar, and I'm here with my students, Ava and Francie. We're continuing our series of videos where we're discussing the Stauffer case and how it relates to adoption research. Last time we talked about parenting adopted and biological children, and then in this episode, I really want to spend some time talking about how the role of adoption competency for clinicians and how important it is for adoptees and adoptive families to have access to adoption competent clinicians. So set us up. What kind of clinicians or services were the Stauffers accessing? Let's begin there.
Yeah, the Stauffers worked with a lot of different doctors and therapists. Their son was diagnosed by some with ADHD, autism. He also needed help with language learning, mostly because he was, from a different country and was trying to learn essentially 2 languages at once when he was adopted. Mm-hmm. And they said in a couple of videos that after multiple assessments, multiple evaluation, that numerous medical professionals felt that he needed a different fit and that his medical needs, that he needed more. And that his whole team of doctors recommended that he spend time with other families that would be better equipped to care for him. Do you kind of think that this is something that usually happens with the care team or multiple people? And would you have recommended rehoming based on the information that you have on this case?
Yeah, so that the last part of that question is kind of hard, not having everything, but but as a adoption professional, I haven't been in the situation where I've recommended adoption dissolution. I have worked with families experiencing very significant challenges, and we have sometimes had to utilize out-of-home placements in like residential care settings for short periods of time. But not knowing, it's hard to say whether the Stauffers are misrepresenting what adoption professionals or what professionals said to them, or whether those professionals actually said that. And I don't know, who they worked with and what level of adoption competency was there for those professionals. But in general, adoption competent clinicians are really skilled in understanding the important aspects of adoption and in helping support adoptees and their families in healing and giving the adoptive parents the skills and knowledge base that they need to parent the children that they've adopted. So that's kind of the main focus. Mm-hmm.
Yeah, so you kind of touched on that a little bit just now, but what are some kind of characteristics or like the main descriptors of an adoption competent clinician?
Mm-hmm. Yeah, so an organization that I mentioned in a previous video, CASE, the Center for Adoption Support and Education, they convened adoptees, adoptive parents, adoption professionals, and really have a detailed kind of definition of what it means to be an adoption competent professional. So their website is great. They have 2 chapters actually in the book that I co-edited, the Handbook of Adoption. So if people want to explore that in more detail, there's some resources there. But the main thrust of the idea is that clinicians need additional training after they get their license to really reach adoption competency. And that training teaches them about a variety of different factors that are important in adoption. So, loss, a lot of the themes we've been talking about, loss and grief, for identity development, themes in transracial adoption and how to help families parent children who are not their same race or ethnicity. So a whole host of different kind of factors that clinicians really need to be trained on additionally. And there's training available in many states. CASE has something that they worked on called the National Training Initiative. That's a web-based training for clinicians. It's free because of grant funding. So any clinician can sign up for that training and do it web-based. And then there's also in-person training that CASE offers at remote sites throughout the US that clinicians can attend and get that certification. Mm-hmm.
That's something like places look for in clinicians, just that certification.
I think it's fairly new-ish. Like the National Training Initiative just launched this year. It was piloted before that. And then the training and adoption competency has maybe been around for maybe 8 years or something like that, 5 to 8 years. And so it's not so widely available, that it's kind of required, but there's definitely momentum, I think, in how widely available it is and how the value that people see in it.
I know that the Stauffers had some concerns about safety of their other children. And so do adoption competent clinicians have tools to recommend just besides adoption dissolution, if this is really the case? And can you describe some of these?
Yeah. So there's definitely family-based interventions that are available of a variety of types. Also, often adoption competent clinicians would maybe recommend respite as a way to give everybody in the family some space and also some time to like gain those skills and build their knowledge base. And different kinds of in-home services are available too. So more intensive like wraparound services that bring together all the professionals that are involved in the child's life to sit down and kind of make a plan for how to keep everybody safe. So yeah, in-home therapies. And then if those things are not helpful or effective after they've been tried, then some short-term residential care is sometimes helpful because that provides more intensive intervention and more time. So yeah, there's a ton of different options on that scale from kind of least to most intensive. Mm-hmm.
I know that adoption dissolution is a super complicated topic, despite some black and white opinions on it.
Mm-hmm.
I personally know a few families that have kind of dealt with really scary situations where the child is dangerous towards, the parents or the other kids. And that sounds like that the Stauffers were hinting at something like that. So is there any instance or situation in which you think dissolution could be the best option?
There's definitely been situations that I've been a part of as a clinician where adoption dissolution has happened. So, or ones that I'm just kind of aware of in the community. One example would be where there's safety concerns about either the child or the family, and then as a result, really intensive services are needed, like more longer term residential care and treatment. And that's quite expensive. And sometimes insurance companies for the adoptive family were not covering that. And so families discovered that the only way to get access to that kind of intensive services was to dissolve the adoption and the child would then become the ward of the state, and then the state would pay for that residential care. So that those situations exist, but that is done more for, paperwork and as a way to get access to those services, not necessarily because the family, plans to end their relationship, with the child too. I mean, the other piece of this is sometimes adoptive parents don't really have a choice either. So most adoption dissolutions happen more often in adolescence. And so sometimes teens, wants to leave and does not want to be part of the household. And so there's less choice for the adoptive parents, in those situations. So yeah, I mean, like you say, Francie, it's very, very complicated. Each situation is so unique. In talking about the Stauffers, I think it's important to think about how the research relates to the different aspects of their case. I don't want to be sending the message that we think we understand everything about what was going on, and are making a certain judgment about them. Mm-hmm.
Definitely. Kind of jumping back to the general discussion of adoption clinicians, because there's a lot to learn from adoption. Still, do you think that it is common for clinicians to misdiagnose adoptees?
Yeah, so I think that it can be common if clinicians maybe don't have a lot of experience or knowledge around adoption to maybe pathologize aspects of the adoption experience because they don't know maybe that loss and grief, for example, are like a common part of the experience and should be processed. Or maybe they're ignoring, clinicians can ignore different aspects of the adoptee's experience and think that it's not relevant when actually it is. So I have heard from families who've worked with clinicians who were, they concluded were not really very adoption competent. And at best, those clinicians were just unhelpful to the families and to the adoptees. At worst, there can be harm. So it just is so important that we have a really adoption competent workforce to help adoptees, adoptive families, really to ensure as much as possible that we achieve this permanence and really flourishing for everybody. Yeah, so this is so valuable. I'm glad we got a chance to highlight it. In our next episode, we're going to talk about the role of the adoptee and the role of the parent in adoption, and maybe talk about this idea of like centering of the adoptee and how important that is. So yeah, stay tuned.